Hi, everybody. I'm back with part 2 of my heart vlog. So, in last week's video, I explained that my genetics doctor, who I just met last week and today, virtually, in person last week, she did a swab test in both sides of my cheeks, and it came back from the lab in 1 week instead of 4. And this is the results. Invitae, which is the name of the swab company, the long QT syndrome panel was positive, long QT type 2, and KCNH2, pathogenic. Given this difficult family history, we will order a few more tests to help try to delineate this further. Through neurology, there will be a tilt table study to rule out neuro-seizure disorder. Referral to EP for consideration of link versus possible device. They're going to decide on what device they're going to put inside. And I'm going to be meeting, like I said, lots of doctors related to the heart in the coming week to a month. The first week of February, I have 2 appointments with cardiology, and I'm going to be setting up the neurology, if I could say that, neurology appointments. And it looks like she said a message was sent to the pharmacist to assess medications for long QT safety. So I believe she is sending that message to their pharmacist at UC Medical with the list of medications that I'm taking to make sure that none of them are on that danger list that could affect my long QT syndrome. Let's see, website reviewed again with the patient. Oh, okay, so I have the website also so that I could check my medications, so that's good. Could potentially consider a beta blocker. However, there is not as much protective benefit in long QT2. Discussed that arrhythmic events in long QT2 are characteristically triggered by emotional stress and sudden auditory stimuli, such as alarm clocks or loud noises, particularly when patients are at rest or asleep. Now, when she discussed this today, I said, I'm glad you brought that up, or I'm glad that the long QT refers to that as one of the symptoms, because ever since I was a little kid, and my parents were arguing for the day about something, my mom or dad would slam a kitchen cabinet or the back door or the front door, and it would shake the house, and it would be so unexpectedly loud because I would be in my bedroom or the living room. And, you know, when you hear a slam, I would jump. And to this very day, I feel like for a second I'm going to have a heart attack or I can't breathe. Now, you guys witnessed that in my last video. When my dog barked at the squirrel and I didn't expect it and I jumped on video. Let's see. Discussed risks for first-degree family members to be screened. She is estranged from most of her family. She is in contact with her son, because he lives here, and he should consider screening as well. This made me cry. She is offering my son, my 3 brothers, and my mother a free screening under my name. And I'm not giving the information here because I don't need people trolling. But if you would like to reach me, which would be my 3 brothers, I think that it would be very much in your best interest to do so, because this long QT2 is extremely serious and extremely dangerous. And I cried for my son. I will give my son that information, hopefully through a text tonight, because our schedules are opposite. He is an all-day sleeper because he goes to work 4 or 5 days out of the week, usually between 4 and 6 p.m. So he's asleep the entire day. And when he wakes up, he pretty much hits the shower, gets dressed, and he's out the door. So I did tell him I would love to be able to have a conversation with him. It is in regards to him as well. So he said, send me a text, but I'd rather talk to him in person. So I'm going to try to do that tomorrow or after dialysis when I come home. But as far as my 3 brothers and my mom, it'd probably be better through Messenger. So, yeah. But anyway, that's pretty much it. In the 3rd grade, I got hit in the head with a football and collapsed on the playground. And before they even created MRIs, they must have been gluing wires to people's heads and shining a bright light in their eyes, because that's what I remember waking up to. They had my head in a sink. It's kind of like a beauty salon sink, and a big giant light in my face. And I remember the words, "Well, hello, sleepyhead," and had glue all over my hair and gluing wires. That's what I was told. And from that point on, I was told by the doctor's staff, I guess, to stay awake late with my parents watching MASH and Cheers and all that. And then, I guess, going to the doctor the next day, being extremely tired, and they would shine that light in my eyes again and do more testing. So I vaguely remember a lot of it, but that's what I do remember. And I've already told you guys about passing out on the toilet. I don't know what grade that was, maybe the late 70s, early 80s. And my mother explaining I've had seizures before. So I did tell the doctor today that the one at the beginning of COVID, when my nurse was losing her cool, decided to pull her car over and scream and yell at me into the phone while punching her steering wheel, because she made a very big mistake and told me to stop taking my blood pressure meds at that time, when the doctors told her to tell me not to stop taking my blood pressure meds. So she lost her cool. I started shaking and trembling on the phone, on the couch, when we were living on government housing. My son saw this, and he forced me to hang up, and I did, and laid on the floor. So I have been having several episodes in my adult years, and they're getting more frequent. I had a difficult breathing time during dialysis last Friday, and I had a very difficult time this past Monday. Yesterday, not as bad. I had a lot of arrhythmia at the beginning of dialysis versus towards the end. I only had maybe a couple. So basically what it's stating is that the type 2 is more serious, and it could be linking to my heart pausing a lot longer than it should. So let me read some other things here for you. Okay, so these are notes from what I talked to her about today. So, genetic testing revealed a variant in the KCNH2 gene associated with long QT syndrome type 2. She experiences episodes of near syncope, which is near passing out, particularly during dialysis sessions, characterized by dizziness, nausea, and a sensation of the room spinning. These episodes are often accompanied by difficult breathing and are more pronounced at various stages of dialysis. She has a history of episodes resembling seizures, including waking up in unusual positions and having her dogs react as if something is wrong. I told her both of my dogs have been jumping on the bed in the middle of the night. It's only been 2 times in the last 30 days. Mostly Snoopy with his paw right here. She is on gabapentin 300 milligrams, which she has been taking since 2012, and has experienced shaking episodes, notably during a stressful event in 2020. She also reports an episode of almost blacking out in the kitchen 2 months ago. She is currently taking Savella for anxiety with recent increase to 50 milligrams. Loud noises and sudden scares exacerbate her symptoms, causing her to feel like she might faint. She has a history of spinal stenosis, contributing to shortness of breath and the need to rest frequently when walking. The patient gave additional notes concerning family history of kidney and heart-related and deformities. I think that is it on the notes, you guys. So I personally spent a total of 42 minutes on 1/29/2026 preparing to see the patient on direct patient care, documenting communication with another provider, independently interpreting results, and coordinating care. Anyway, so there you have it, everybody. I will continue just to live my life the best that I can. I value my relationship and friendship with my entire family, but I feel that what I go through is disregarded. I feel sad, slightly depressed about it, and I feel like the black sheep in the family. All because I have all these health problems that I feel like I am such a burden. Sometimes I feel that my health is too much. But to my mom and my brothers, I just wish that you would unblock me and be a civilized adult in your 40s and 50s and stop all of this. Just stop. It's not necessary. I'm scared to death. I'm really scared. And sometimes I'm afraid to go to sleep at night because I don't know if I'm going to wake up. But every day I thank God that I am awake and alive. Anyway, thank you all for listening. Peace out and stay positive.